Hello and welcome to yet another edition of Network Africa with yours truly, Cynthia Rare. This edition is one which promises to be upbeat and uplifting, to say the least. We'll be celebrating our continent by looking at what's going well in spite of all the challenges. Let's begin by looking at our health and sports. If you watched last week's edition of the program, you would recall that I spoke to our sports correspondent concerning Ebola fears as the African Cup of Nations was about to kick off. And here's a little excerpt from that chat.
The president bought 40,000 tickets for the fans. So it means that the fans will come. And for them to come to the stadium, they would not display that level of ignorance. Even a while ago here in Nigeria, we were afraid about Ebola. But when we knew, we got some facts about Ebola, we were living our normal lives. Ebola was there until we were declared Ebola free. And that's what's going to happen in Equatorial Guinea. People will come out and enjoy the football. There will be hugs, there will be tackles, there will be pulls. There will be handshakes, there will be celebration. And I think the confidence will come from the fact that, the next man to you has been thoroughly examined.
Indeed, Yemi was certainly right. There really wasn't much to worry about, at least so far so good. I say that because the Cup of Nations began successfully on the 17th of January, and up until now, it's looking good. In fact, things are so good that Equatorial Guinea's Minister of Sports and LOC boss, Francisco Pascal, has hailed the country's performance in hosting the tournament despite the controversial build-up, which included a hasty late switch of hosts in the wake of the concerns over the Ebola virus.
Authorities in Equatorial Guinea are happy with the African Nations Cup being hosted in their country after a hasty switch of hosts in the wake of concerns over the Ebola virus. Complaints about lack of facilities and fears that newly laid pitches will break up dominated the build-up to the tournament, which kicked off on Saturday, January 17th. Few previous editions of the biennial Continental Championship have had such a dramatic backdrop, with the hosting of the 2015 finals, which switched 2 months ago after Morocco asked for a postponement due to the spread of the Ebola virus in West Africa. That request precipitated a crisis that left the tournament having to be organized almost from scratch in a few weeks. Sports Minister and Chairman of the local organizing committee, Francisco Pascal Obama Aswe, on Monday, January the 19th, said he was content with the matches played so far.
As the president of the Federation, I'm very happy with everything we have done to get prepared for the people of CAF and FIFA. We are saying that 4 years, it's not 50 days. So we ask to be excused for the little issues that people are experiencing by us hosting. But we can see that the competition is going on well. The first matches started and finished well without any problems. The Group C matches here in Mongomo will take place without any problems. I, as the president of the Federation and the Minister of Sports, will be visiting all teams in the next couple of days and the stadium here to make sure everything is okay.
Before kickoff, a lack of hotel rooms, the standard of some of the accommodation, poor training facilities and blazing sound system at the Estadio de Bata left several coaches seething and critical of the organization. Aswe said that there were a lot of successes in the organization of the tournament and urged journalists to report them.
Bueno, lo único que hemos dicho es que tanto periodistas.
We are saying that both journalists and visitors should speak the truth and not lie about this event. We, the people of this country, expect journalists to tell the truth about this tournament. Even though we are not given much time to prepare for the event, people should look at the positives here.
From a country with widespread poverty in between ostentatious displays of its newfound oil wealth and who have previously bid to host the World Cup, the Nations Cup is now being played in one of Africa's smallest and most enigmatic countries. Equatorial Guinea, a family-ruled former Spanish colony, is reveling in rescuing the continent's most eagerly anticipated sporting event. It was the only country willing to step in at the last moment, saving the finals from being moved to Qatar. It is a tournament that this time has no clear favorites and in which almost all teams believe they can emerge as champions at the end of the 3-week event.
Now, speaking of Ebola, there's more good news. Schools have opened for the first term of the year in Guinea after remaining closed for months because of the outbreak. Let's listen to the story of Safiatou Sampo and her brother Musa, who were up early to prepare for school. Safiatou Sampo and her brother Musa are up at daybreak getting ready for school in Conakry, Guinea. It's the first day of school after a long break. Schools reopened on Monday, January the 19th in the country, 3 months after the start of the school year was delayed because of the Ebola outbreak. During their extended vacation, Safiatou and Musa kept up with their schoolwork with a private tutor. Guinea's Ministry of Education developed a protocol for a safe school opening, and now students are getting back to class. The protocol includes temperature screening for all, washing hands with soap and water, minimizing physical contact, and not sharing water bottles and food, and what to do when someone gets sick at school. The students are also being educated on the disease. To avoid the Ebola fever, you have to wash your hands before eating. You must wash your hands with soap and water.
When one gets infected with Ebola, you get a fever. If you get close to him, you get infected. And also when a sick person is vomiting and you touch the vomit, you get infected.
Some schools reported that many students had not turned up. Parents say they were not prepared after a government decision to reopen schools. Schools across the country received 48,000 hygiene kits from the United Nations Children's Fund and other partners, who also trained over 80,000 teachers on Ebola preparedness.
The schools were closed for the summer holidays. When they needed to open again in October, they couldn't open it because of the Ebola outbreak. So it took us a few months to work together, try to identify, try to learn what needs to be done so the schools are we can make the schools as safe as possible.
According to the World Health Organization data, Ebola has killed more than 8,400 people in neighboring Guinea, Sierra Leone and Liberia in what is deemed the worst epidemic of the viral fever on record. Well, we're still looking at how well Guinea is doing in the fight against the Ebola virus. One of the strategies in place is being executed by the Guinean Red Cross. They're lending expertise to the Ebola mission by conducting safe and dignified burials, which is one of the pillars in the fight against the deadly disease.
This team of health workers is getting ready to bury the body of a Guinean who succumbed to Ebola in Conakry. A team of workers from the Donka Hospital and the country's Red Cross usually work together to ensure that bodies infected with Ebola are moved from the treatment center and buried safely.
There are two organizations involved in the transfer of the body, the Red Cross and Médecins Sans Frontières. The role of the MSF is to take the body from the center to the door, to bring it to the entrance. We then take the body and put it on an ambulance and proceed to conduct a safe burial in a public cemetery.
Safe burials are one strategy out of a 5-pillar approach being employed in the West Africa Ebola response. Donning full personal protective equipment, or PPE, the Red Cross team meets MSF workers at the center's entrance. The body inside a special body bag is then put on an ambulance and driven to Cameroon Public Cemetery. One of the major hurdles in the fight against the disease has been unsafe religious practices. Ebola, which has no known cure, is spread by contact with the bodily fluids of the infected. Mourners would often touch the corpse at burials, exposing themselves to high risk of contracting the virus. Convincing people to change these practices has not been easy.
People think that these bags are designed to bypass religion because, to tell the truth, these bags are unknown to the religion. But these bags are used just to protect not just us, the workers, but also the families. Because we put the body in the bags so that the family can bury it without risk. That is the job of the Red Cross in the Ebola mission.
Donc c'est ça un peu le travail de la Croix-Rouge dans la mission Ebola.
After properly disinfecting the PPEs and the body bag, the body is driven away. If the family so desires, they can conduct a ceremony before it is placed in the grave. Last week, the United Nations reported that the outbreak in West Africa seemed to be slowing down, though the battle to contain the disease is not over. According to the World Health Organization, Guinea reported its lowest weekly total of new confirmed Ebola virus disease cases since the week ending August the 17th, 2014. In neighboring Mali, the country's health minister declared the nation free of Ebola on Sunday, January the 19th, following a 42-day period without a new case of the deadly virus. Mali recorded 6 deaths from Ebola, which according to the World Health Organization data has killed more than 8,400 people in neighboring Guinea, Sierra Leone and Liberia, in the worst epidemic of the viral hemorrhagic fever on record.
Now, the Liberian government has done very well to announce that it will no longer enforce a presidential order on mandatory cremation for Ebola victims. But many people are not happy that barrels of unidentified ashes remain at a local crematorium. And that's because it serves as a stark reminder to the public of the worst days of the Ebola virus.
The furnace has been extinguished, but the ashes and charred bones of Ebola victims remain piled up outside a crematorium in Boys Town, Liberia. A row of barrels containing the remains of hundreds of unidentified people are labeled only by a sheet of paper indicating the dates that the bodies were incinerated. The site stands as a reminder of the deadly epidemic that claimed more than 3,500 lives in over 10 months. In an effort to contain the virus, President Ellen Johnson Sirleaf's government ordered mass cremation in August after scores of people contracted Ebola at traditional burials.
Yeah, these bones are kept for the memorial service. Our memorial service will be here for those who remains are in there. Yeah, there will be a memorial service here, but the memorial service will be conducted at the burying site.
Ebola, which has no known cure, is spread by contact with the bodily fluids of the infected. Mourners would often touch the corpse at burials, exposing themselves to high risks of contracting the virus. The worst epidemic of the virus on record has killed more than 8,400 people and infected some 21,200 in Liberia, Sierra Leone and Guinea since it was detected in March. That is according to the WHO figures. More than 3,500 of the dead were from Liberia. Progress has been made in Sierra Leone, which has recorded the highest number of cases, and Guinea. The WHO said on Wednesday, January 14, that the 3 countries had recorded their lowest weekly number of new cases for months. With the worst seemingly past, Liberia is gradually coping with the loss, but for many people it is hard to properly mourn loved ones whose bodies may never be recovered.
We support the efforts to eradicate Ebola. And like I said in the press statement, on Tuesday, I mean, how can anybody who lives in this area, who observe the daily parade of their fellow citizens being brought here and incompetently dumped and burned, with the very smoke of those remains saturating the air and our homes, how can you ever forget that? The psychological and environmental cruelty is unimaginable.
The ashes of the victims at the crematorium are waiting for dates to be transferred to the cemetery for a burial ceremony. The Liberian government is also discussing compensation with the community. With specialized teams trained in safe burial techniques to prevent infection, victims are now being interred in a 50-acre cemetery by the highway to the Roberts International Airport.
Coming up, it's a race against time for those who are trying to come up with a cure or vaccine for Ebola.